Another rotation on this side, and then you can also do.
The rotation is how many?
You can do as
long as
many strokes, or
okay.
maybe I can do like 10 strokes as well on this side. 1, 2, 3, 4, maybe 5,
Okay.
and then on the other side 5. Okay, rotation just to relax the joints and the muscles. Okay, and after that you can do. So if you have cramps, right, you can also do this type of exercise. So right, because it actually stresses the muscle here. So for cramping, right, the muscles that's involved is the muscle here. It's called your gastrocnemius muscle. So you can also do stretching. Okay, and then after that you can do finger walking. Okay, so you can do. Okay, you can do like finger walking on this side. Okay, or you can do thumb walking. But for me, it's better if you do finger walking. It's more comfortable to do finger walking on this side. Okay. Okay, finger walking. And then after that, you have to open up the feet. So by doing horizontal direction. Okay. Yes, inner to outside.
Ang sama-sama lagi.
Okay. Inner to outside. I can feel a lot of nodules on the feet.
So meaning have you? I got callos
And
from the shoes.
so
From the shoes.
I can feel. So after that, you can do finger walking again. So just hold from here, and then just do.
Got libag already. Okay.
So it's dirty already.
Oh, this one is dead cells. Okay, never mind. Okay, take
Okay,
it.
so you just have to do like and you can do also finger walking as well.
Okay lang yan, bebe. How many minutes? Bebe,
Like you can do 5 to 10, 5 to 10 repetitions on the side. Because this is gonna be 1 hour, so you just have to take your time. And then after that, you can do thumb walking on the different zones, right? We discussed. So you have, because I didn't cut my nails, you have to make sure that you cut your nails. So I'll just do like this. Okay. Sorry, yeah.
Ay, sarap naman yan. Oo, sir, masarap sir.
Okay. So you have to make sure that you cover all the 5 zones.
Oh, okay.
Okay. Then after that,
Saan ba natin?
so I mentioned last time, right? This area here, this is your brain area,
Brain, yes.
head in your brain area.
Head.
So this one is your shoulder, neck and shoulder. So you can also focus on the shoulder as well. Okay, you can do like this. You have shoulder pain, stiffness. I can feel something. I can feel nodules here. Okay, and then you can do. This one is the chest area.
Chest.
Okay, chest area. So this involves if you have breathing issues, shortness of breath, you have your coughing, because on the chest area, this actually covers your lungs. So if you have issues with your lungs, right, normally you suffer from difficulty of breathing. Okay, difficulty of breathing, maybe you have chest pains, to just stimulate the ball area. See?
Oh.
I can feel something here.
Yeah. That one is for lungs.
So if the patient or if the client feels something, you just have to press it. And then at least 3 to 5 seconds, and ask the patient to inhale. And then breathe out. Okay, inhale. Breathe out.
White pain.
Okay. So it's tender because I pressed something here. There's a nodule. It's like a air inside. So there must be something wrong.
Is it lamig, sir?
Okay.
Oh my God, something wrong with me.
So on the chest area. So since this is this area belongs to your chest area, there might be some issues with the lungs.
Breast cancer?
No, difficulty of breathing. Okay. So you can always tell the patient to do inhale, exhale as a part of his daily routine, her daily routine. Okay, so that breathing issue. Okay, next is that's number 7. And then after that, you have to work on this area. So this one is your hip area down here. So hip and then down. So normally we have, if you have low back pain, if you have sciatica is where you experience like pain from here up to this area or back because there's a vein.
Parang cramp.
Okay, it's not actually cramp. It's actually painful. Maybe because of too much carrying, and then there's a displacement of the vein. And then for me, I have sciatica. There's actually pain up to here. Maybe too much work, or standing up. That's sciatica.
How about slip disc, sir?
Slip disc.
Because it's really painful also.
Okay, mind you, this is your spinal cord.
Oh.
Okay, so if it slip disc, you have to walk all the way, depending on the level. Because the spinal cord, we have your cervical, we have your thoracic, and then we have your lumbar area. So it depends on the area. So this is one is your spinal cord area. Okay, so this one here, if you have sciatica, you have back pain. So you can do all the different techniques. Okay. Anyway, this is just a preparation. Later on, we go with the different techniques proper. Okay. Okay. So after you complete everything, okay, and then this is your solar plexus.
Oh, the finger says stomach part, sir, right?
Yeah, correct. So what I'm doing is I'm not only using my thumb, I'm also using my body. Okay? The reason why if you're using the thumb, it's just like pressure like that. But for me, I just... Is it painful?
Yes, sir.
Is it okay?
Very strong, sir.
Okay? So just like that. And then go back here again. Okay, and then just do...
Libag-libag first.
Okay.
And after that, circling your knee. So it's like relaxing.
Okay.
The final.
Okay, so this one is... I did mention
Is this
about...
Oh, wait.
We're not only treating the symptom, we're treating the entire one. So this one is your entire body. Because for Western white, when you go for doctor, they just give you Panadol for headache. But for reflexology, we're treating the entire body. However, if you have asthma, because these are dangerous, right? You have to take your Western medicine first. Alright? Your salbutamol. And then after that, you can do reflexology as a complementary. I did mention about complementary technique, right? It's just a secondary. But you still have to go to your doctor. If you have cancer, if you have different conditions that needs a doctor, to see a doctor. So you have to see the doctor first and then just take this as a complementary. This is not a treatment. Okay?
Yes, sir.
Okay, next is we have to go to the different techniques.
We still need the videos, sir.
No, continue. We continue.
Still here.
Okay, we have your first is your finger and thumb walking. So finger and thumb walking. Thumb walking is sorry, hindi ako.
5 zones, sir.
So you have to cover the 5 zones. And then after that, you can do finger walking. Or you can do just like this. The direction is actually towards the heart. It's not away from the heart. Because we're bringing back the lymphatic blood flow going back to the heart.
Sorry, sir. Thomas never cut nails.
Okay. Okay, so that's finger and thumb walking. You can use the thumb here, and then you can use the finger on this side. Okay, and then
I notice that every time at the back, we use the thumb.
yeah, because it's easy for you to manipulate the area that's going to be treated.
Of course. Okay.
Okay, you cannot do like finger walking here. You might as well do the finger walking on this side. Okay, another technique is your Sorry. Where's the technique? Okay, we have your rotation on the point. Okay, when you hear the word rotation on a point, you just have to stabilize and then put on the area and then just rotate.
Rotation on a point.
Okay, that's rotation on a point. So on your next meeting, you need to look for a partner. Then we have to perform the different techniques.
As exam, sir, is it?
Before the exam.
Before
The exam, because eventually on your midterm exam you're gonna have your written exam, and on your final exam it's gonna be your practical exam.
This,
Yes.
So the practical exam is by December.
Huh?
Practical exam is by December.
Yeah, correct. But I'm still need to teach you on how the proper technique, because this one it's difficult for some students to learn.
Yeah.
Especially pivoting, rotation, and a point and everything. Okay, that's all for today.
And then, sir, no more? Okay.
Dito libag, be, yung ano ko,